I think in previous two sessions you already met me. So today I am going to discuss about not a new topic. This is also very much familiar to especially our group, nurses group, care of bedridden patient. Actually, we know, but why we discussing this topic? Why it's very important in palliative care means this care is totally not a new. It's very experienced fellows are here. I know, but as a part of the caregiver education or for the patient getting better care from the family members, these are all the things we need to explain or we need to educate the caregiver too. So, first of all, why we need to give this care for a bedridden patient? Actually, a bedridden patient or maybe completely bed-bounded patient means their life is mainly in bed, or maybe their life is somewhere around the bed or inside the room only. So here, why we giving care to the bedridden patient means for preventing the further complications by health-wise. Example, if the patient is suffering with some of the distress or due to any disease condition or maybe due to the progression of disease, now patient is in a completely bedbound stage. So further health complications, at least we can minimize or we can avoid by providing a better care, nursing care, proper care. Then for just comfortness for the patient, then the patient itself just feel the confidence to live until his or her death due to the disease condition. Then feeling of isolation we can prevent to the patient. Why? Because better care we giving, so there is no foul smell or maybe the patient getting a nice good feeling effect. That's why patient doesn't feel any isolation from the family or from the community. Then at last, the for improving the quality of life. At any time, we cannot, all the time, we cannot improve the quality of life, at least to maintain the quality of life of the patient till his or her death. So, basic needs of a patient. If somebody is asking to us, what are all the basic needs? Our basic needs are what? As a human being, what are all our basic needs? From our childhood itself, we just seeing that basic needs of a human.
Air, water, hygiene.
Air, water, food, shelter. Okay, these are all the basic needs of a human. But here we're going to discuss about the patient. Patient also a human, but just for a time period we discussing us like patient. Their basic needs are listed here. From the head to toe, what are all the care patient need to get? These are all the basic needs of the patient. What's the reason? Already I told, one person is becoming a bedbound stage means their world or their surrounding is only, they are limiting in bed or maybe they are limiting inside the room. No other influence is there. So total care need to give to the patient from the caregiver side or from a second person side. So these are all the care we going to discuss, and these are all the care we need to thoroughly explain or educate to the caregiver for getting proper care for the patient from their side itself. So first of all, oral care. Oral care, what are all the purpose of oral care? Actually, oral cavity or the mouth is an excellent incubator for a growth of bacteria. Not the bacteria, as like microorganisms, will grow inside the mouth. Here, if after taking food, patient is not washing their mouth or oral rinsing is not at all doing by the patient means the food particles will be there in the oral cavity in between the teeth or gum side, lip side. It will collect there, and this food material after some hours it will decay and it will cause to the microorganisms will grow up there. So it leads to some other infections too. From the oral cavity, the infection chance is there to transfer from mouth or oral cavity to inside of the gastrointestinal system. So here the main purpose to remove the food material. By removing, we can prevent the microorganism growth, and along with that we can ensure the lips mucosa and soft tissues inside the mouth will be very clean and intact without any ulcer or without any inflammation. So with that steps, we can promote comfort and improve the nutritional status also. Proper oral care patient is getting means patient will feel a good appetite, patient will take nice food, patient will feel taste for food. So patient can take food, and along with that good nutritional status also maintained for the patient. Then in the step of oral care, us like brushing or just rubbing the gums with our fingers means it will stimulate the gums and teeth, and it will help for the blood circulation in the gums. So we can maintain healthy firmness or healthy gums for the patient. Then bad smell also we can avoid or we can prevent. Some of the common oral problems also we can discuss. First one, dry mouth or painful mouth, that we can say it as like xerostomia. Xerostomia means this one, dryness. Due to the over dryness, the mucosal layer the skin will break down, and it will make chance for getting bleed, and the patient will feel the burning sensation too. So this one is a painful situation. That's why we saying by giving oral care, we can prevent the oral dryness. So here this one is a second condition, oral candidiasis. This is some of the major problem we mainly seeing in our palliative care setting, because the patients with poor oral care, not only due to the poor oral care, with some of the medication, with the effect of some chemotherapy, this oral candidiasis is very common basically in the palliative care patients. So proper oral care we giving means we can prevent or we can manage this oral candidiasis. Another one, halitosis, foul smell. Basically, the halitosis or foul smell of the oral cavity we can prevent or we can manage with the steps of oral care. But some other medical conditions are there. Maybe Kusumal breath. According, it's related to the diabetic conditions. I'm not telling like that, but here the oral halitosis we can manage by proper oral care. Then mucositis or infection or inflammation of the mucosal layer inside the mouth, basically tongue. So another one, next we can discuss about who need mouth care or which are all the category persons need actual mouth care or oral care. So first one, terminally ill patient. Long-term patient is in illness stage only due to the disease condition, or maybe due to the progression of disease condition, patient is getting deteriorated. So in terminal stage, or maybe the period of the terminal illness of the patient stage, proper oral care need. Then unconscious patient, or maybe altered conscious level of the patient is totally unaware about the oral care, or maybe patient if know how to do the oral care, but now the condition is deteriorating, patient is becoming unconscious level. Basically in palliative care we can call it as a end of life stage. That stage also we need to give proper oral care. Then if the patient is breathing through mouth, uh, already we know if the patient is taking breath by nose means inside the nostril we have some hair follicles. The air while we entering time, the hair follicles act as like filter. It filter all the insects, all the dust particles, microorganisms. Very minimal only it will enter. So, but here while breathing by mouth means everything, which are all the things is seeing in the atmosphere in the air form, it will attach with our oral cavity. There is a more chance for getting infection or inflammation and oral problems too, from oral to internal part of the gastrointestinal tube. So this category patients also need oral care. Then post-op, after the surgery, some period patient needs some rest, but patient is not at all deteriorating. Due to the immobilization, patient maybe will be in immobilized stage for getting rest for the surgical part. So for that period also, patient is unable to wake and do the oral care. So oral care need to get from a second person side. Then if already the oral cavity having some inflammation or infection, or maybe some due to or oral cancer condition, in that conditions already the inflammation and infections are there, it's fungal or bacterial. So here also proper oral care need. At last, but very important, these category patients, some of or majority of the caregivers having no awareness about the patient, it's needed to give oral care for the nasogastric tube feeding. Their thought like they are nothing giving by orally, everything they are giving by nasogastric tube itself. But then why it's needed to clean the oral cavity? No, at least a drop of single drop of water also they are not at all giving by orally. Then why it's needed? So that unawareness is leading to lack of getting poor oral care for this type of nasogastric tube feeding patients. But we need to give proper oral care as like other patients if the patient is in nasogastric tube feeding only. So we need to explain to the caregiver the importance also. Then some of the assessment while seeing on patient in front of us, some assessment, cracked lips, dryness or coated tongue, any oral candidiasis sign is there or not, any ulcer or any lesions is there or not, any redness or bleeding spots is there or not. Everything we can assess while seeing on patient oral cavity. Then already existing pain or due to any reason the pain is there or not, we can assess. Then if the patient is saying any swallowing difficulty, painful swallowing or change in altered taste, already if the patient is tasteful in non-food item, but now the condition is changing, now the taste is not at all feeling for the patient with the food, then we need to assess. Then any difficulty for chewing the food items, then anorexia, unpleasant bad smell, then any medication history related with that. These are all the things we can assess and can do the management accordingly. Then here, some solution we can suggest for this patient to clean the oral cavity. First one, homemade saline preparation, normal salt only. As a part of the oral care, we can explain to the patient caregiver to provide 1 glass of water, 1 pinch of salt. They can add and they can use for gargling. If it patient is capable to gargle, means after food, maybe TDS basis or 6th hourly, they can do the oral care. If the patient already having existing an oral thrush or oral candidiasis, means they can add soda bicarbonate also, 1 pinch soda bicarbonate also they can add in this 1 glass of water, then they can use it, helpful for the oral candidiasis. With the oral care, suppose any medication is needed, means topically, then we can move to the topical medication, or we can move to the oral tab or injection. Anything is needed means we can do, but basically we can do this type of care we can do by using these type of solutions. So as a part of self-care education, if the patient is capable to do brushing or do the oral care, means we can educate them to do at least 2 times in a day. They can do brushing by using soft toothbrush. Why? Because a soft toothbrush they are brushing, means it will give some massaging effect also to the gums. So there is no chance for bleeding. Already existing mucosal, any chance for the inflammation or infection, means the soft toothbrush we using, means it will prevent chance for getting inflamed. So they can use soft toothbrush. Along with that, if the patient is using toothpaste for the oral care, means they thoroughly wash it in multiple times with the gargling. If the toothpaste part is lasting or remaining in the oral cavity, means it leads to the oral dryness. So we need to explain to that. Then already I told they can use gargle with the help of normal saline or soda bicarbonate according to the oral problem. Then with the soft toothbrush, whichever the toothbrush they are using for tooth brushing, same brush they can use for just brush the tongue also. Because in soft brush we using for tongue brushing means it will prevent the palate, the taste buds. It will not inflamed. Then plenty of fluid they can take. It will helpful for the nourishment. Then some enzymes having in the pineapple. Anyhow, this pineapple is an acidic material only, but some minimally they can use some pineapple pieces. They can use because it contains some enzyme. It will just salivary stimulant effect is there, so they can use it. Then if the patient, in mainly elder patient, they are practicing to use any dentures, means at night time, usually they are doing, but somehow they are all not at all doing, means we can explain to them to remove the dentures while night time while sleeping. Then we can move to the procedure for the patient requiring the assistance. If the patient needs some support, but the patient is able to do the brush means the facility we need to allocate to the bedside itself. So here the steps we explaining as like our nursing module, but this thing only we need to explain or we can educate to the caregiver also. We need to explain or how, then why, what is the importance, everything we can explain. We can promote the patient. We will give some support or what are all the support you needed means we can provide. You can do the brush. That's important. Everything we can explain to the patient. Then only make them to sit with comfortable position and with comfortable devices. Every item should be in their bedside itself with the support. Then they can do brushing with the support of the caregiver. Then after brushing, proper oral rinsing, multiple times they need to rinse the oral cavity. Then procedure for a terminally ill or patient is completely bedbound in unconscious level means that patients, these are all the things we can use for giving care in the oral cavity. Here, what are all the instruments? In this part, we have some videos. At last, we can see. Here, some of the articles you can see. Majority you are all practicing in hospital setting. What are all the articles needed for giving oral care? Same itself, in right side home care setting. What are all the things we can use it for the oral care? Why this difference we showing means as like the home care setting articles, if we are practicing in home in hospital setting itself means it is very useful and it is very easy to educate to the caregiver also. So how well the care is getting in the hospital care itself setting itself, same quality care they can practice in their home setting also. So that's why the some articles difference are there. Here in hospital setting, for just holding the cotton piece or gauze piece, we using the artery forceps. But in home care setting, mainly we saying they can use just old brush. They can take old brush, cut their teeth, then they can rotate. They can cover with using some gauze pieces or cotton cloth pieces. They can rotate, or the spoon backside handle part we can just cover with the gauze pieces. Then they can dip it in the same solution, whichever the solution we, according to the scenario, we making them to do the oral rinse. Same type of solution they can use it for soaking this type of prepared things. After squeezing, after dipping, squeeze very well. Zero droplet need to enter in the oral cavity, or otherwise in unconscious level means collection of fluid, it will leads to the aspiration. We need to avoid that situation. So after squeezing out complete dipped solution in this prepared stick or spoon or brush, prepared brush, then we can insert inside the mouth and can clean in every part of the palate, teeth, and in between the lips and every area with a single stroke we can clean. For opening, for keeping the mouth to open, same type of one spare thing we can use it for, as like tongue depressor, this same thing only, and one spare thing we can use it for keeping inside the mouth to keep open the oral cavity while giving the oral care. So here this picture you can see. Actually, this is what I mean. In video, in detail, we can see. These are all the steps I already explained. Then as a nurse, these are all the things we know. So in detail, I'm not going. So after the oral care or after cleaning the oral cavity, is it either by rinsing or by the oral care? Right? After that, some lubricants we can use it in the lips for avoiding or for preventing the cracks or dryness in the lips. So in home remedy means ghee oil or ghee we can use, or otherwise coconut oil they can use. In commercially, they are purchasing means the facility is there, liquid paraffin and the Vaseline. These are all the materials they can use it for giving common, they can use it as a common lubricants after the oral care. So in video, at last we can see it together. So next one, care of eyes. So already we know for a normal person means the oral care, eye care, and everything. As like in morning, our routine, our activity itself, we will cover. Just washing the face itself, we just cleaning our eyes. But here in terminally ill or this type of bedbound patient, the proper eye care they are not at all getting means the tear glands secreting this tears just will dry over there, and after dryness, suppose they are trying to clean this area without any soaking means it will leads to the any just skin peeling or maybe the inflammation on the tear glands, so it will chance for getting infection to internally too. So the proper care for the eyes is very important. So here we explaining as like they can use, or in our setting also we using cotton balls, wet cotton balls for one cotton ball for a single stroke from inner canthus to outer canthus direction. You can use in home remedy. They can use cotton cloth or cotton clean towel. They can use, but one corner of the cloth they can use it for one stroke, and another corner they can use it for the second stroke. Same area, multiple stroke, it's not at all encouraged. We need to explain why. We need to explain. Then after soaking this cotton balls or maybe the cotton cloths, then they can use it for cleaning the eyelids from inner canthus to outer canthus direction. Then care of nose and ear. Togetherly, we say as like our main intention while caring for nose and ear, we need to clearly visible or clearly examine the foldings or backside of the ear and every area. Why? Because in bedbound stage means sideline position, suppose the patient is maintaining for a long term means as a part of the pressure sore, these areas are all very getting very chance for pressure sore. So here the skin, their ear foldings, backside of the ear, everywhere we need to thoroughly examine. one more thing, fungal infection also there is chance is there because sweating and it will collect over the foldings itself. It getting chance for the fungal infection. That thing also we need to assess while giving care. So thoroughly need to clean and every foldings and backside of the ear and internal ear canal also we need to examine any wax deposition is there or not. Proper time we need to remove the wax or otherwise it will cause for the internally ear pain or suppose some itching and hearing problems also at last it will happen. So we need to prevent these type of complications. So proper care for the ear is very very important and nose also we need to take care. Then care of hair. So majority of the patient, maybe the proper caregiver support they are getting, multiple caregivers already in their home means most of all they are just shifting the patient from the bed to the bathroom and they are trying to give proper bath, proper bath in home in bathroom itself they are trying. But some of the family having one caregiver or maybe the minimal caregiver with some health problems for them also. In their setting, they cannot transfer the patient to the bathroom and give a thorough bath. So most of all, they are doing sponge bath only in the bed itself. That type of patient, not at all just wetting their head or hair, proper care for the hair, not at all getting for such patient. So how we can give proper care for the hair as like a hair wash, how we can do. Basically, in our nursing field, we know, I think everyone know, that thing we need to explain. Just bring patient head to the tip of the bed head end or otherwise corner of the bed head end, then just cover on underlaying on plastic sheet or any Macintosh or underpad, anything plastic material, something they can just corner itself. They can make it as a roll form and keep their head inside the plastic sheet. It will provide the drooling of the water content to the near to the trunk and other bed areas. Then this plastic sheet remaining part we can put it in inside an underlying one bucket. So while pouring water on the head, the water completely it will channelize inside the plastic sheet to the bucket. So we can prevent wetting of further parts of the bed and further part of the patient body. So in that way, we can wash their head. Before washing, two steps we need to do. First one, just plug their ears with the cotton balls properly. We need to prevent the entry of water content inside the ear. Then one more thing, just cover their eyes with some cotton piece of cloth or some kerchief because suddenly we while pouring time any water content is suddenly they are meeting with their eyes means it will leads for they getting anxious and it will maybe reason for the BP shoot up. So that thing we need to prevent. So cover their eyes and plug their ears before pouring water to the hair. So after pouring water, according to their practice, shampoo or any other Ayurvedic some material they are using means according to their practice, they can apply on their scalp and hair. Just rub and do gentle massage and they can wash it off. So after washing or after giving proper hair care, they can apply oil or any other things they can apply and comb their hair and tie it well according to their practice. So same way we can explain to the caregiver the practice which helpful for the caregiver too. It will reduce the caregiver burden and the patient also will get a nice feeling of goodness. The next one, nail care. So here nail care, proper nail care is very, very important, mainly in geriatric population or continuously terminal ill stage, bedbound stage means their skin health is very low only. So proper nail care they are not at all getting means due to this nail they are rubbing or scratching means it will cause for the skin peeling and some wound also will form. So the importance we need to explain. In some cases, some caregivers feel some difficulty to cut short their nails because basically in diabetic condition, in some other conditions, underlying the nail buds itself, the flesh will be there. So we need to educate them to soak for 5 to 10 minutes inside basin containing water. So after that soaking, we can easily cut short the nails. That step we need to explain. Then nail corners also need to cut, not in a straight way. Nail corners also need to cut without just making wound. Then bed bath. Bed bath or sponge bath. Some cases, if the patient family is affordable, means they are all using some alcohol wipes or any easy bath, like some things they are using for giving sponge bath. But majority of the patients in palliative care, they are all not at all affordable. So maximum cost effective method we need to explain to the patient family. So, with the help of one bucket of lukewarm water or the cold water, whichever the patient is comfortable. If taking lukewarm water means we need to check the temperature before pouring or before just applying to the patient body. We need to check the temperature. Then, with the help of this water and one more water we can take, and we can, if we are wetting their body, means we can wet their body. We can apply the soap itself just with the help of the lather of the soap we can apply. Then one more wet cloth we can use it for wipe it off. We can clean it off the lather of the soap from the body thoroughly. The soap, we need to ensure the soap material not at all lasting there on the skin. We need to remove completely, or otherwise it will cause the dryness of the skin. So after giving the sponge bath, we need to give proper back care also. Back care is a step we need to give for just giving a massaging effect. It will help for the skin good health. We can promote blood supply underlying areas. Along with that, it will help for assessing the area. If there is any chance is there for any getting pressure sore. At least a single color change. If we see means also we can consider that color change as it is a first stage of the pressure sore. So every day as a part of the back care, we need to do the assessment. We need to educate to the caregiver also the importance why need to take care the back side of the body. Not only the back side, whichever the body part getting more chance to contact with the mattress or contact with the bed for a long term, that all areas they need to assess and give the back care or proper skin care by applying some moisturizing thing in cost effectively. We can explain or we can promote them to use petroleum jelly or bioline. They can apply on that area. They can give some mild gentle massage. They can give. It will help for the good blood supply. Then pressure ulcer. I am not at all moving to the pressure ulcer its stage and everything, but pressure ulcer, you all know. If one patient is continuously lying in bed in one position for a long term, means underlying tissues getting chance for getting contact with the mattress and continuous pressure getting that areas getting chance for ulcer or skin peeling. It is the pressure ulcer. These are all some of the sample pictures. So whenever we giving the back air, just color change is feeling means itself, we need to very carefully, we need to manage. Then we can prevent some other stages of pressure sores. We can manage from the first stage itself. So pressure sore coming means we know what are all the things we need to know. In every stages, what are all the management we need to do. Everything we know. But as a part of the prevention, some steps we need to explain to the caregiver. First one, position change. If one patient is in bed-bound stage, means every 2 hourly, we need to change the position. We not at all just simply saying change the position. We need to demonstrate to the caregiver how we need to change the position. In some cases, without support, if suppose making one patient in lateral position means after some time patient will return back. So some comfortable devices, comfortable pillows, cushions, or any roll towel with the support only, we can place the patient in the position. So every 2 hourly, whichever the position, whichever the comfortable things it's needed, we need to explain to the patient family. With the support, we can turn around every second hourly. If the patient is in chair bound or in wheelchair, maybe as a part of the rehabilitation, after completion of the shifting of from the wheelchair to the bed and bed to wheelchair, the patient family maybe will go for a work. That daytime, patient will be in the wheelchair. So maybe more than 6 hour, more than 8 hour, continuously they are sitting in wheelchair means in below the waist level, they are not at all having any sensation. So there is also chance for getting a continuous pressure points, getting contact with the wheelchair parts. So chance for the pressure. So with the help of their hand support on the handrest of the wheelchair, just apply pressure to the handrest of the wheelchair, just pull their trunk or just raise their trunk. Just in mind itself, they can count 1 to 10 seconds, they can count. The same method they can do every 15 to 20 minutes, they can do. So during that period, some relaxation, some pressure relieving, it will happen on their below waist level. So it will prevent the pressure sore for the chair bounded patient also. Then manage incontinence. Incontinence of the urine and motion. Basically, the incontinence of the urine. Incontinence of urine management is first line is not at all maybe the catheterization. If any urology consultation is there needed means can do and do the management accordingly. Or if having the history about their disease condition, only the catheterization is the management. We know thoroughly means we can do the catheterization. That's why we put as manage the incontinence according to the scenario. Then some special surfaces also they can use air mattress, water mattress, proper pillows and cushions. These are all the things we using for just giving chance for reducing the pressure zone. So wherever the patient is lying, air mattress, water mattress, wherever may be, we cannot prevent the pressure sore. We can reduce the risk of pressure sore. One thing we need to keep in mind, we need to convey to the caregiver, if they are an air mattress, water mattress, or normal mattress, every second hourly they need to change the position. Otherwise, there is a chance for getting pressure sore. Then along with that, proper nutrition and hydration, patient is able to take oral as nicely means they can take plenty of water and a nutritional diet we can include them to take. Then proper exercise also important. So here, along with that, we need to proper back care also. These type of patients are also needed. Proper back care with the help of the liquid paraffin or white petroleum jelly. It will reduce the risk for the pressure sore. Then whenever we making bed, we need to demonstrate and we need to educate the caregiver also. Wrinkle-free bed they need to maintain for the patient. Because if they are lying in continuously in the wrinkle bed means according to the shear force effect itself, the some sixth stage of pressure sore chance is there. So wrinkle-free bed is very, very important along with the nail care also. That importance we need to explain. So here the prevention already we explained this step. We in short form we can call it as a skin. So first is representing supporting surface, airbed or like that. Then skin inspection. Then K, keep moving, position changing, incontinence management, I, and N, proper nutrition and hydration. So these are all the steps for preventing the pressure sore. Then exercise. Here, one patient is we say seeing in completely bedbound and in terminally ill stage itself. The exercise, it's very, very important. This type of patient exercise we giving not at all making them to walk or maybe we not at all making them to do any job. We know condition is deteriorating, patient is going to end, but here we need to maintain the quality of the patient. So we doing active and passive exercise for the patient for maintaining the quality of patient. At every time we cannot improve the quality, just maintaining the quality. So by giving this type of exercise, we can prevent the contracture. We can promote good blood supply to the muscles and the joints also. We can prevent the contracture, foot drops and wrist drops also. So proper exercise we giving means we can prevent the contracture. So by preventing the contracture, we indirectly just respecting or we maintain the autonomy of the patient. Because in contracture stage means in end of life, maybe in death time, there at last we need to think about that, but it's very important. Death stage also, contractured body means it will affect the autonomy of the patient if maybe in dead body itself. So we need to very keep in mind, and it's very important. Then catheterization. Catheterization, we are all know type of catheter and everything. Indwelling catheterization. In indwelling catheterization, mainly we using Foley's catheter and silicon catheter and everything we know. Then intermittent clean catheterization, NELCAT, with the help of the NELCAT we doing, and Euro condom we using externally for only for the male patient. These are all the type of the catheterization. How often need to change and everything we know. Foley's catheter means monthly once, and silicon catheter means once in 3 months. Everything we know. But what are all the things we need to explain to the caregiver? That's the important thing. I'm not telling about the steps and the catheterization process. We need to explain every month they need to change the Foley's catheter. This rubber type Foley's catheter need to change every once in a month. Then silicon catheter, they need to change once in a 3 months. We need to explain to them. Then only they will make the arrangement to do the catheter change. Then if the patient is in catheter itself, proper perineal care is very important. Wash the perineal area with soap and water is very important. We need to explain to the caregiver to give to the patient. Then proper position, they need to keep the euro bag. In some cases, some patient family, they are just placing the euro bag in between their legs in the bed itself. We need to explain the importance. By a gravitational force only urine is coming out, no any other pulling effects is happening. So below the waist level, they need to hang the euro bag in their bed itself. That's the importance we need to explain to the caregiver. Then empty the bag. Whenever the bag is filling with the urine, 3/4, it's a maximum. Half is safe, 3/4 is the maximum. Bag is filling with the urine, they need to evacuate. Then if the patient is an indwelling catheter means they need to take plenty of water. 2500 ml to 3000 ml they need to take within 24 hours. If the patient is able to take, we need to explain clearly. Then the proper output according to the input is there or not. So they need to measure in between anything is disparity is there means we need to address the issue and do the management. Then one thing we need to clearly need to convey to the caregiver, wherever, however sterile manner we needed, we doing the catheterization means in continuously catheterize the patient, some UT history is there and UT chance is there. So what are the things need to do and they need to careful, we need to clearly explain to the caregiver. Then do the management according to the symptoms of the UT if the patient is having. Then care of perineum. Already as a nurse, we know what are all the things we know we need to explain to the caregiver, and importance also with the help of the soap and water, perineum of male patient or the female patient, we need to educate them to do. Otherwise, they will give the sponge bath, but the perineal area they will not touch. It will cause the fungal infection, and some infection it will carry purposefully, it will carry through the catheter to the internal to the urinary tract. So the chance we need to prevent with the help of the proper explanation and the need. Then bowel care. In bowel care, actually we saying in bed bound stage means due to the lack of the exercise, because initially the patient was doing their bowel movement and their toileting will do in the toilet itself. Now the patient is in bed bound stage. Lack of exercise, privacy, or reduce of food intake, reduce of high water intake, or due to the influence of any medication, the constipation it will cause. So we need to assess their bowel pattern. Then any other medicines, laxative medicines is needed means we can provide, or otherwise we can educate them. If the patient is capable means we can educate them to take high fiber diet and fluid intake. But in some cases, the high fiber diet is not at all helpful for the patient. It will make them discomfort. In that situation, we need to avoid. Otherwise, if the patient is able, according to the disease condition, means we can educate them to take high fiber diet and the fluid intake. Then regular exercise, at least simple movement, range of motion exercise they can do, because in supine position continuously they lying down means the internally the colon parts are floating. There is no movements is there. Involuntary movements inside our body it's happening as a part of the bowel movement, but no voluntarily they are not at all moving. As a part of this exercise, the body will get some voluntarily movement. It will somehow it will help for the bowel movement. So that thing also we need to explain. Then proper bowel care means already we discussed, due to the toileting facility, there is no toileting facility, or maybe patient is in bed itself. So there thing we can give some equipments, bed pans they can we can give, or otherwise patient is able to wake up from the bed means we can provide some chair commode or wheel commode we can give for the defecation with the proper privacy, with the help of locking the room, or just giving some privacy with the help of the curtain or the screening. We can do, we can facilitate them to do for the bowel movement. Then if the patient is suffering with the spurious diarrhea, we need to assess, we need to ask the history. When last completely evacuated in satisfactory manner, that thing we need to assess. Then only we need to do the management. Spurious diarrhea means it's a part of the constipation only. I think we are you all know. So as a part of the management, per rectal examination we need to do. According to the examination finding, we need to do the management. Manual removal is needed means we can do manual removal, or digital evacuation we can do. Along with that, high sodium phosphate enema is needed means we can do. Otherwise, any source to loaded it's happening means we can apply some Dulcolax suppository also. According to the finding, we can do the management. Then at last, we can see the nasogastric tube feeding patient. Here also, I am not at all telling about the procedure for inserting. Here, we need to explain some of the steps to the caregiver, some of the mistakes patient family is doing with the nasogastric tube feeding patient. First of all, we need to give on Fowler's or semi-Fowler position we need to give before feeding. One thing we need to convey to the patient caregiver before setting the position or just making the position for the patient, before itself, do the arrangement. What are all the food items? What are all the things they are prepared to give feed? Everything they need to grab near by the patient bed, set everything with the water and everything. Then only they need to change the position, make the position Fowler in semi-Fowler position. Then only trying to feed, or otherwise making the position, then moving somewhere means it will chance for fall, accidental fall will happen to the patient. So that thing we need to convey to the patient. Then before recapping the tip of the NG tube, just pinch the tip of the tube, then only they can just open the cap, or otherwise the air entry will happen. Then before feed, just aspirate and make sure the tube in the stomach, if more than 50 ml is there means skip the feed. We can skip the feed, or otherwise we can feed. After, while giving the feed itself, while preparing time itself, we need to ensure properly grinded material. No food particle is not at all supposed to block the tube. We need to ensure. So properly grinded food particle only they can mix it and prepare for giving feed. Before feeding and after feeding, they need to give some plain water to clear the tube. The importance we need to explain, or otherwise they will not do. Then basically, I'm telling about the palliative care patient. I'm not telling about the patient generally you seeing in the ICU setting. In palliative care setting, terminally ill, condition is deteriorating. In that type of patient, every 4 hourly, this is the maximum value I'm telling, 200 to 250 ml. This one is the maximum. Maximum they can limit the food content within 200 and plus or minus water they can use it for before and after for flushing the tube. So minimally they need to control the feed quantity, or otherwise this patient is having no activity. There is a no time for getting digest. So overly their pooling effect will happen inside the stomach, this food material, while after feeding, changing the position, making them to supine means there is a chance is there, it will regurgitate and it will getting chance for enter into the lungs. It will aspirate. Chance is there for the pneumonia. This complication also we need to explain, because due to the love and affection of the family members, they are trying to feed them more because they need to make them to maximum healthy. So they will feed more. But why we need to minimize the feed? The importance we need to explain. Then only they will take care about that. Then after the feeding, again 20 to 30 minutes, same fowler or semi-fowler position, whichever the position we maintain, continue 20 to 30 minutes after the feed, then only can change the position. So that importance we need to convey to the patient. After the feeding, we need to clean the oral cavity also. Already I discussed, after the oral cavity, we can apply some things for the moisturizing lips for avoiding the cracks on the lips. Then we know for fixing the rails tube or nostril tip, we will use some adhesive material for fixing. In between, periodically, we need to change the position from the nose tip, or otherwise some skin peeling chance is there. So that thing also we need to keep in mind and we need to explain to the patient family. So now we can see some of the videos.
Any questions? Sangeeta, can you take that chat questions? So, Reena ma'am is asking, bladder wash can be given if there are sediments in catheter. So, nowadays, bladder wash is not recommended. If there is any sedimentation there, you can remove the old catheter and put a new catheter and see whether there is any sedimentation persist. And another option is you have to check, you have to assess the patient if they have any signs and symptoms of urinary tract infection. So is there any signs and symptoms of urinary tract infection? Treat that problems. So otherwise, this doesn't cause anything, because usually the urinary bladder urine was clear, but after when the urine come up from the bladder to the catheter, so catheter is made up of Foley's catheter is made up of the latex material. So because of the colonization, that make changes and coming out through the tube and into the bag urinary bladder, you can see some sedimentation, but most of the time it not it from the urinary bladder. So always you have to change. If you have seen these kind of sedimentations, you have to change remove the catheter and put a new catheter and see. So, but nowadays the literature said bladder wash is not recommended. So if you do bladder wash, what happened is you will be that giving spreading the infection the overall bladder. So you always you just if the sedimentation into the urinary catheter, so they that you will push it into the bladder now, so that all bladder will infected. So mm, you have to just assess, and if they have a urinary tract infection, and then you can treat. So we can move on to the case presentation. Priyadarshini will be presenting a patient story today. Priyadarshini is over to you. Thank you.
Yeah, thank you, ma'am. Good evening, everyone. My name is Priyadarshini. I'm working in Kite Senior Care as Dementia Care Manager, Nursing Manager. So today I'll be presenting a case based upon our dementia setup. So patient age is 66 years. She's a female and she's diagnosed with Alzheimer's disease and query FTD, that is frontotemporal dementia. Her presenting complaints were like fever 2 days, discomfort, jerky involuntary movements left side, and left upper limb weakness, and left hand drop was noted. And she was refusal for food was there, and behavioral issues, and she was looking drowsy. So history of illness, as said, she's a 66 years old gentlewoman with the above mentioned diagnosis and was admitted into a care center for dementia care and support care. So she was with us from the year, like from June 2022. It's almost 2 years now. It is a long-term care. So we take care of long-term care dementia residents with us. So she's almost there from 2 years. And all these 2 years, she was very mobile and she was tolerating to all oral feeds, and she was mobile. I mean, moving, wandering, everything was fine with her. So then she suddenly developed recurrent fever episodes, noted, managed with antipyretics and oral antibiotics. All vitals were stable. So on to 22nd April 2024, there was sudden onset of lower limb involuntary movements, left-sided noted, and left upper limb weakness was there, and hand drop also noted. So we suspected it as CVA. Next is examination. On examination, her vitals, pulse rate was 102, saturation was 98% in room wear, and temperature was 101.6 degree Fahrenheit, and GRPS was 101 mg per dl. BP was 140 by 96 mm of Hg, and GCS score was E2, V1, and M4. She was febrile, and we did MRI for her, which showed CVT and thrombosis in sagittal, transverse sinus, meningeal enhancement were seen, right parietal intraparenchymal bleed was present. CNS, she was drowsy and arousable, left upper limb weakness, hand drop positive, left lower limb jerky involuntary movements was noticed. So treatment and significant investigations, as said, we did MRI brain and EEG was done. So HB, her hemoglobin was 7.7, which was treated. Other blood parameters were normal. In view of intermittent high-grade fever with jerky involuntary movements, patient was sick because ours is residential setup. So we can't be doing like CT, MRI, EEG and all. She needed immediate admission, like higher center care. So we shifted her to a nearby super specialty hospital for ICU care. And we received her back in view of poor GCS for palliative, long-term palliative rehab care again and further plan of treatment. So family was counseled regarding the condition of the patient and the poor prognosis was explained. And we counseled her because she was not able to take orally sufficiently, and to prevent the risk of aspiration, we counseled the family for PEG feed and in view of patient nutrition. Family agreed on the same, and patient was shifted to the nearby hospital for PEG tube insertion on 29th May at an hospital. So procedure was uneventful. Post PEG insertion, patient was stable. Feeds going on with regular dressing because PEG feed stroma is there, so we are doing regular dressing. Patient had review on this 6th June with the gastroenterologist team, and patient was hemodynamically stable, and patient was discharged, and we received back her in our residential setup. So next is psychosocial aspects. She's a widow. She stays in a residential setup that is with us. And both her children, she has 2 children, both are staying away from her family, away from her center. So hence family visits are not frequent, it is minimal. So we can see financial burden for the family. Already she's there 2 years with us when she was in almost like in the last stage of dementia. Plus like almost like 10 years, she's suffering with this illness, with the dementia. So financial burden, as she's not having no insurance coverage is there for her expenditure. So long-term care, this is going to continue for like many years. We don't know how many months or days or years. This is going to be a long-term care. Next is medications. Based on a thing like jerky movements, seizure history and all, we started her on tab Lacosette 50 mg OD and tab Lacosette 75 mg OD, which she has to continue regularly, and tab Levipil 1 gram BD. Tab Admenta, this is a drug used for dementia patients to improve their memory and thinking. And tab Immunosfort, it's a multivitamin. Tab Shelcal 500 mg calcium supplement, and tab Amantadine, and tab Dolo for a pain management, and tab Apixaban 5 mg. It is to prevent DVT and PE, pulmonary embolism. The next is main concerns. So main concern is like basic main concern in nursing for this patient is to prevent pressure ulcer, preventing skin infection, mainly SSI, because she has an opening for peg feeding. So we have to prevent surgical site infection, and preventing UTI, urinary tract infection, and other infection control protocols has to be taken care. And mobility and activity, that is we have to, since she has become bedbound now, we have to take care of her mobility to prevent all this pressure ulcers, everything. So we have to keep repositioning hers every second hourly. And bowel and bladder care, communication and engagement, and pain management, comfort care, which is long term, to improve quality of life, caregiver burden, that is our nursing staff and care staff, care assistant staff. So definitely there'll be a burnout. So we have to care for that also. That is a major concern. And emotional support and family education and support. And finally, end of life care. So basic summary is a 60 years old gentlewoman with the above mentioned diagnosis was admitted into a care center for dementia and support long-term care. In view of intermittent high-grade fever with jerky involuntary movements, patient was shifted to hospital for ICU care and received back here in view of poor GCS for palliative rehabilitative care and further plan of treatment. Family counsel regarding the condition of the patient and the poor prognosis explained, and counsel for the PEG feed. That visa and patient is hemodynamically safe stable now. She's here with us in this center, so she has completely become bedbound. Although we are moving her with a wheelchair, but still she's bedbound, and PEG feeds are continuing for her every second hourly 250 ml. So discussion points will be like how can family be an active participant during the palliative care in dementia patients? That is our first point. Second point will be from the point of view of a patient suffering from dementia, how can the caregivers and the therapists provide holistic care and comfort? Third will be expression of pain and suffering is a barrier in this case. How can we facilitate and deal with this issue? So dementia patients, when once the dementia starts and it progresses itself, we can't communicate either because communication will be the biggest challenge here in dementia cases. So how can we facilitate and deal with this issue? Will be my discussion points. Thank you.
Thank you, Priyadarshini, for the wonderful case presentation. I hope
Thank you,
this
ma'am.
case presentation is clear to everyone. So this is one of the challenging patient story. So Priyadarshini is the apt person to share your experience with us because I have seen very few patients here. When
Yes.
I see this case presentation, so I thought this is the best presentation we can discuss together and learn many things because we
Yes,
learn very few things. Very few patients I have seen in my last 20 years of experience. So
Okay.
I think we can go back to the main concerns and come
Yes.
back to the discussion points again.
Yeah, sure.
So please discuss all. You have to try to involve the discussions because we need
Yes.
to understand together. So the first
Yes.
concern, main concern is preventing pressure ulcer. So what all things you will do? So we can, this is for a dementia patients, we need to do everything. So what
Yes.
all things you have to keep it in mind. So please put your answers in the chat box. You can, or you can unmute yourself and talk. Others, please. Prevention of pressure ulcer. Whenever you have seen a patient with, in a bedbound situations, you have to give a proper, if they have a proper caregiver, we can educate the caregivers. But otherwise, what all things you have to keep it in mind. We already discussed many times about this. Anybody?
Change the position.
Change the
Every
position.
2
Very
hours.
good.
Then mild massage.
Yeah. So when we turn the patient, when we change the position, you have to give a proper attention to the pressure points, and so that we can able to identify if there is any changes there. So
Yes.
and after that you have to give some massage, so that take some the simple moisturizing agent and then give a massage, so that we can able to improve the blood circulation. Through that we can able to prevent pressure sore formation. Then
Water mattress,
water
wrinkle
mattress or
free,
air mattress. Air
uh,
mattress is the good one. So if
wrinkle
possible,
free,
you can suggest the air mattress.
wrinkle free bed sheet, while
Definitely.
making the bed.
Very good. Provide wrinkle-free bed. Then
Take care of the nutrition of the patient.
nutrition, that is very, very important. If that nutrition, lack of nutrition is one of the most common cause for developing pressure ulcer. So that is very, very important. The nutrition. Protein intake is must for preventing pressure ulcer formation. Then
Care of the patient's whole body also. While patient is
definitely, yeah,
continuously on bed,
definitely. Mm.
lubricate, massage the body with some oil or some lubricant to prevent
Yeah.
the frictions
Yeah.
while pulling and all.
Okay. So and one more thing that incontinence. Moist is
Incontinence.
another major cause of
Yes.
pressure ulcer. So you have to prevent that. You have to protect the skin from
Catheterize.
that also. Okay. And friction. So we have to avoid the friction. Okay. And then next is preventing skin infection. So sister was telling about percutaneous that um,
Massage.
kind of, yeah. So gastrostomy feeding is going on now. So we have to give a proper ostomy care. That area we have to keep it clean, and that identify assessment for assess for any signs and symptoms, or any inflammatory signs, redness or infection. So always you have to keep it that area clean, and that maintain an aseptic technique. Okay, so that we can able to prevent infection. And preventing urinary tract infection, we already discussed. Uh,
Perineal care.
yeah. Anybody want to add any points for preventing urinary tract infection? We already seen a video on catheter care. So uh, when we insert a catheter into the bladder, I already said there is a chance of urinary tract infection. So always you have to educate the patient to take a plenty of oral fluids. Here,
Hydration.
yeah, here that is not possible. So we can give through feed. So maintain that hydration, so that we can able to prevent urinary tract infection. And the another important point, prevent constipation. So if the patient is having constipation, there is a chance of urinary leakage. So if there is, and also block is also there, the neck of the bladder will that obstructed with a hard fecal matter. So the residual urine will be there in the bladder all the time. So that leads to urinary tract infection. So prevent the managing bowel part is also important. So always you have to give a better assessment and give proper care for the bowel also. And the another important thing is perineal care. So these are the 3 points very, very important. Perineal care, that area they have to clean with soap and water, take plenty of oral fluids, and the another thing is prevent constipation. So these 3 points are very, very important. Okay, and the other points are also important, but these you have to keep it in mind all the time. And mobility and activity, definitely for a bed-bound patients need a active or passive exercise because we need to prevent contractures. So need a proper physiotherapy. Bowel and bladder care we already discussed. Communication and engagement. So that part I would like to hear from you, Sister Priyadarshini. And pain management again, how did you do the pain assessment for a dementia patient? That also I would like to hear from you. The other all points we already discussed: family education, emotional support, caregiver burden. That is one of the most common issue here because dementia patient, they will not able to recollect anything. They always forget many things. So they don't know what they are doing. So these kind of situation, the caregiver is the person to struggle a lot. So we need to give a some kind of relaxation for the caregivers also. So that's I understand from the patient's side and the caregivers side, putting ourselves into their place. How can we manage? That's it. How can we overcome this situation? So we definitely this caregiver need a respite. This patient need a respite care, so that the caregiver get some relaxation, some relief, at least a 1 week care. So bring the dementia patient in the hospital for some time and keep the patient there, and the nurses and the other healthcare workers will take care of the patients, and at the same time the caregiver will be free for that time, so they can go anywhere, they can stay with their loved ones, and so after that they can come back and collect the patient. So these kind of provide that care you can try to provide. So over to Sister Priyadarshini. So we would like to hear from
Yes,
you.
ma'am. Yes, ma'am. So communication when dementia starts in mild and moderate stage, communication will be fair enough. It will be okay. But when it comes to severe stage, then it's what it will become very challenging because whatever they say, we have to agree, but we can't argue with them. That is the thing. But in her case, in this patient case, like already there's a communication barrier because the patient, where the thing I shared is she speaks only Assami. Okay, she can understand Hindi, but she can't reply back. But she was here with us 2 years. Most of our South Indian caregivers, they don't speak Hindi. Okay, very rarely we get some Assami or Bengali speaking people who speak in Hindi and try to communicate. But in her particular case, it's just a miracle, or what should I say? I don't know, because she's there with 2 years with us. It is all that emotion and the love factor which worked with her very well. The way how we talk to her, how we smile to her, that mattered a lot. And she is the best apt example in patient case for when it comes to nursing care, showing love and compassion towards a patient. Because none of us know Assami, but she used to try and understand whatever Bengali we talk or whatever we speak to her in Hindi and little bit of English. So all this made her a huge difference in treating her for all these 2 years. So now also when she went to the hospital, I showed her thing. She went to a hospital and she came back. So when we went and visited her, she was not able, although she's having dementia, their past memory will be intact. So they can remember like their son or daughter, whoever it is. Like they can remember. Only the thing is like how when they saw them in the last period, maybe 10 years before, son maybe 20 years or 30 years, they can remember only that kind of figure in their mind. So my son must, they have a particular image. It is not that after 10 years, son will get older. The new image they will not get. But she was recognizing her son, everything. But here, when we went to visit her in the hospital setting, she recognized us. The nursing whoever was taking care here in our center, she recognized us and she shared her emotion by crying and touching, giving a smile and all. That was the one wonder which we noticed in dementia. It's just a research, right? Still study is going on to know what is dementia exactly. But in her case, memory, which a recent memory was very good for her, and she was able to communicate with us just with gestures and all. Pain, when it comes to pain, she will reply in her own thing like actions, winking her eyes. You
Body
have pain,
language.
definitely, yeah, body language. She'll use the body language and she will wink her eyes, all that she does it. She will cry, she will hold her hand. Okay, where is your pain? I'll touch you, answer. Then she will just wink her eyes. So that's how we'll come to know that she's having pain and discomfort. And as I said, involuntary movements, we know already she's here from 2 years with us. So we know how is her behavior, normal behavior, aggressive behavior, whether she's agitated, she doesn't like someone, what is it? We know her completely. So the complete study was done. So in that way, we were able to assess how is the pain and what is the abnormality that is she's facing through her body language. So discussion points: how can the family be an active participant during the palliative care in dementia patients? So how can if anyone wants to say anything, you all can just say if anyone is working in dementia centers.
Yeah. So
If
anybody
anyone is
wants to
working in
contribute
dementia.
anything? How can the family
Okay.
be an
Yeah.
active part? Anybody? So from the communication class, what you have to understand is you have to listen. One important thing, you have to listen and explore their emotions. So we have to
Yes.
understand their insight, and so then only we can understand their problems, right? So we be an active listener and understand their problems. From my side, is over
Yes.
to you.
Yes. Yeah. Yeah, definitely, ma'am. We have to be a good listener. Then we have to have lot of patience, whether it can be with dementia patients or any palliative care. We should, as a nurse, we should have a lot of patience. We have to listen to them. And then we have to give time. It is time consuming job. I can understand when it comes to palliative care and dementia care. It's a time consuming job. You can't work for 6 hours or 8 hours and just leave it and just go it away. You have to do your best to the patient and go. And at the end of the day, you will get your job satisfaction also. In this case, like how can the family be an active? So what we do is we encourage patient's family to visit, to ask them to come and visit at least weekly once or twice, ask them to take. But in this case, she can't go outside. So we encourage family peoples to come and be a part of their physical care. So while they can come here, they can spend time to them, at least like grooming, sitting, talking to them. In case if they can't, but most of the patients, they will remember their family. If not, at least showing them some old pictures of the family with good moments, whatever they have. We call it as a magic book or magic album. We have all the photos of the past when they were young, when they were very normal. So we used to show all that pictures, whichever they like, and they will be having some very closed connected items with them. Like for example, it can be a purse or they were whatever they were using regularly, those items. We will show that also. And that will be a very, they'll go into their very good old memories, so they can recollect it and they can be happy. And when coming to like other care, physical care, we will involve the families to come, spend time with them, sit there, spend time with them, talk to them, or bring anyone who was close to the patient, and we spend gives time to them to take care of them for some time, not the whole day and all, at least for few hours to spend time with them. So that is about the first thing. A second thing is from point of view of a patient suffering from dementia, how can caregivers and therapists provide holistic care and comfort care? So comfort care, like whatever we discussed, everything matters. We will not go, we will give a patient-centered approach in this. When it comes to holistic, like comfort care, we try to maximum to give our best care to them, all nursing care. So we try to arrange a caregiver who's well experienced with dementia as well as nursing skills. So both who are good with dementia care and nursing skills, we select the client, staff like that, and we post to them. So they will be good enough in taking like all dementia when the patient is restless or agitated or whatever they do, just to calm them and settle them to understand what dementia is, what are their needs. And second is nursing skill, because she's on a lot of tubings like Foley's catheter and the PEG feed, to understand that a normal caregiver cannot do. So definitely a nursing skilled caregiver will be there. So definitely will be giving a nursing staff who's trained on dementia to just give a extra comfort care and holistic, just to complete the holistic care. And obviously she will be needing physio. So in terms of that, we will not be very aggressive with physio and all. Just a basic physio, like doing like active like normal movements to prevent the contractures, as we discussed earlier. And the third is expression of pain and suffering is a barrier in this case. How can how can we facilitate and deal with this issue? Definitely, when she is having pain, definitely she will not say that I'm having a pain. But just some body movements and facial expressions of cry, definitely there will be a changes in that. So we keep a track on that, whether she is able to sleep. We know her what is her sleeping pattern, when she'll go for potty, all that we will be knowing according to the timings. Based on that, based on the first facial expression and our body language movements and all, we will come to know like how she's expressing her pain. Based on that, we'll assess her, we'll do a complete assessment, and then we will be managing her pain. In case if her diaper is wet, definitely she'll show some kind of changes and like discomfort and all, like where she's wet with the diaper and all. So that time definitely, I mean the motions and all, then that time we will definitely change the diapers and all. This is how, like, more like we know how she's there with 2 years with us and how it things goes negative or something like that. But definitely we will know about her physical body language and her facial expressions. That is a matter like in dementia patients. We see most early the facial expressions and how they are, whether they are silent, their mood, behavior, everything matters a lot when it comes to dementia care.
Okay, thank you, Priyadarshini, for the wonderful explanation, because so this is very, very important. Today, we have learned on important point is language barrier. So from the communication class, we learned about the communication barrier, but now we have received a patient story like this, so we can able to correlate with that presentation also here. Always from if they are not able to communicate with their language, so we can see their facial expression, non-verbal expression, so through that we can identify their problems. And from in the end of life care situation, this is the same situation, they will not be able to communicate. So when we turn the patient from one position to another position, we used to see their facial expression. If there is any changes there, that means we know some pain is there, then we will give some analgesics. So sometimes they used to give some voice, some that kind of screaming sounds will be there. So that time we can understand that this patient is having pain. So these are the ways we can able to do the proper assessment. So not all the times, so the sometimes verbal the communication is not possible. So this is the another way. So now we understand that. So again, so big thank you, Sister Priyadarshini, for brought out this wonderful patient story presentation, because dementia is one of the major that challenging things. So we are struggling to always nurses and other healthcare providers will be struggling to manage these kind of patients and family also. So thank you all. Thank you, Sajan, for the wonderful
Thank
Thank you,
presentation.
sir.
Thank you, ma'am.
Thank you, Shiva ma'am, for facilitating in their session. Thank you, Sajan,
Thank
for
you so
your
much.
presentation. Thank you, Priyadarshini, for the wonderful piece presentation also. Thank you all for joining. Thank you. Let's see you in the next session. Thank you.